Hi everyone, welcome to Skin Sense. I'm your host Janine Lassant. We're back here with Dr. Steve Schleicher, and if you are equipped to be in one of our clinical studies that we're going to be talking about today, you can be a part of a study that will help with determining some skin conditions.
Absolutely. Right? Yeah, we're on the cutting edge with a number of studies, a number of conditions. And hopefully they'll benefit the community, okay? Because patients who are in clinical studies get free medications, and you get paid for actually using the medications. So it's really a win-win. And some of these conditions are very, very common. One is not very common, that's neurofibromatosis.
And we're going to be talking about 3 specifically today, but first we're going to be talking about the neurofibrosis. Am I saying that right?
Neurofibromatosis. It's a toughie.
How about that? Supercalifragilisticexpialidocious.
Right.
Stick to that
You
one.
did graduate third grade. That's
awesome. There we
go.
You stick to the studies. Now, before you get excited about these studies, you need to know specifically what the condition is and if you qualify to take part in it, right?
Absolutely.
So what is this, first of all?
Well, neurofibromatosis is actually a condition that affects the nerves. Okay, and it starts when an individual is very young, and you could see these little spots on, like, infants, okay, and like 3-year-old, 5-year-olds. They're called cafe au lait spots. And if you have more than 5 or 6, then sometimes we suspect that you may develop neurofibromatosis at a later age. And then when you become a teenager, sometimes people get freckles under their armpits, okay, called axillary freckling. And then over time, patients with this condition start to develop these nodules and these tumors.
Okay. Now is this cancerous?
No. Fortunately, the lesions are virtually non-cancerous.
Are they painful? Are they itchy?
They're very unsightly. Okay, they can be painful. Okay, depending on where they are. Obviously, if you have, lesions on your back and you're sitting back, or on your backside, you're sitting down, yeah, they can become painful.
Is this something that you could surgically get removed?
It's a very good question, and some people have hundreds of them.
Oh my gosh.
Yeah, so it becomes very, very impractical to remove these lesions. Okay, so what we do is we remove the lesions that are painful, okay, or that some are very cosmetically disfiguring. Okay, but to date, there hasn't been a really, really good treatment for it. And you might ask, how do people get it?
Yeah.
Okay, it's said to occur in about 1 in 3,000 individuals. Okay, so it's not that uncommon. It occurs equally in males and equally in females. All right, and it's kind of like a genetic disease, which everybody has chromosomes, everybody has genes, and it just takes a little tiny imperfection in one of your genes to cause this condition. And what happens is, normally we make these proteins that help control our nerves from growing. But if you have this mutation, then you don't have control over the nerves, and they start growing in these tumors and nodules underneath the skin, and then they pop up, outside the skin, and that's when everybody can notice them.
Okay. So if your mom or your dad have this, chances are that you can have it too.
Well, if your mom or dad carries the gene for this, you, as a kid, or as a baby, have a 50-50 chance of developing neurofibromatosis. But the other thing is they're what's called spontaneous mutations. So that a lot of people with neurofibromatosis have no relatives with that gene.
Oh.
But it just happens. For some reason, something goes a little berserk, and then you develop that special lack of a gene that controls nerves.
So what is the checklist of someone who thinks they might have this and they're listening to the show?
Right. Most people who have it know they have it, okay, because they've been worked up before for their skin conditions. So virtually everybody out there, knows it because you have these tumors and you have these nodules. And it's very easy to check, okay, to find out what they are, okay. And what we're excited about, you mentioned surgery,
yes.
Okay, and up till now, that's really the only treatment we had, which isn't a great treatment if we have, more than, say, 8, 9, 10 lesions. It gets very, very impractical to cut them out. Like I said, some people have scores of lesions. Okay, you can have 200 lesions. Okay, so a company has developed a gel that you use once a day, and the hope is that this will help perhaps even shrink these nodules. Okay, so that's why we're really excited, because to date there's nothing out there. So just think, if you can use a gel and put it on once a day. So the study lasts X amount of months, okay, almost a year, okay, and you're seen every month. Patients are paid for using the gel. You get free medicine, and you're paid, I believe it's $100 for using the gel each time. And each time you come in, you get a check for $100. So it's really, I think it's going to be really worthwhile. We're keeping our fingers crossed that it's going to help many people. And if you think about it, 1 out of every 3,000 people have it. Some have it to a very minor degree, some have it to a major degree. If we can help these people with this new medication, that would be wonderful.
And the number is on your screen if you think that you qualify, or if you want to be if you want more information about it.
Right, if you want more information, call Dana. Okay, Dana is the clinical coordinator. Her number is on the screen. And sure, we'd love to evaluate you.
Very nice. Well, we are going to be talking about acne in the next segment. There's going to be a clinical study for those who have acne.
Right.
We'll talk about the specifics when we come right back. You're watching Skin Sense here on SSP TV. Welcome back. You're watching Skin Sense here on SSP TV. I'm your host, Janine Lassant, back here with Dr. Steven Schleicher, and we're talking about clinical studies for a couple skin disorders. We are talking about acne. When I looked down at the list for the next skin disorder, I was thinking, most people have gone through some form of acne in their life. This is specifically for acne scarring.
Correct.
Okay.
Correct. And you may bring a good point up. 3 out of 4 teenagers have acne.
Yeah.
Okay, so you're talking tens and tens of millions of people with acne. And usually, when you're growing up, you get a pimple now and then, it's no big deal. But for some people, it is a big deal because, number one, they get more than 1 or 2 pimples. And number 2, if they don't get treatment, chances are pretty good if they have severe acne, they may get scars.
And if they have acne and then you see them touching their face and popping their face and scratching their face, that's what leads to the scarring.
It can. Yeah, that's a no-no. Okay, so we discourage that.
Is acne something that you can avoid getting, or is acne something that just is, again, something in your genes?
Yeah, that's a great question. And by and large, if you have a family member with acne, chances are great that you'll probably get acne to some degree. Okay, but acne depends on a number of factors, a primary one being hormones, okay? And we know that a lot of women develop pimples around the time of their period.
Yeah.
So that just goes to prove that hormones do play a major role in acne. Other things can play a role too, if you're using occlusive makeup, okay?
The masks right now, masks are
absolutely. The masks are
kids
triggering a lot of acne. You're absolutely correct. So
stress you have on this list. I guess stress would increase.
Stress can aggravate acne, okay, for sure. And one of the problems is when you're stressed out, you tend to pick at your face.
Oh, yeah.
Okay, and you dig and you pick. And what happens? Well, you leave a scar that way. Okay, so
now,
that's not a good thing.
How do you treat acne itself?
Right.
Are there different things? Because aren't there stages of acne? Like you
Right.
can have a little bit of acne, but some people's faces seem like covered and more inflamed.
Absolutely. And if you have mild acne, there are over-the-counter products that you can use that might take care of it.
Now, what would you call minor acne?
Minor acne, you develop a pimple now and then.
Okay.
But anytime you have a pimples that can lead to scarring, we don't call that minor. I mean, once you have a scar, you have a scar. So, but if you have mild acne, go to the drugstore, pick up something that has benzoyl peroxide in it or adapalene in it. These are 2 medications that are over the counter that treat the vast majority of people with acne. The problem is if they don't work, then you really want to see a dermatologist and get more specific treatment because, again, we want to prevent scarring. Plus, acne doesn't look good.
Right, and what actually causes the scarring? Is it the scratching, the picking, the...
Inflammation, okay? So if you have pimples that are red, pimples that are pussy, and you see some people with these big cysts, okay? You know, those are the type of acne lesions that can leave scars, because the inflammation actually helps destroy the tissue underneath the skin. And what happens is it's replaced by scar tissue.
Now, could acne be painful?
Well, if you have cysts, you've probably seen people walking around with these cysts every so often. Yeah, they can be painful. Most of the time, no, it's not. It just looks horrible.
Can you inject medicine into the acne then?
Mm-hmm. You absolutely can. Okay. If you have bad cysts, we routinely inject the dissolving medicine. The sooner you do it, the better.
Yeah. Okay, so the scarring, how do you treat people at home who have scarring now before this clinical study?
Right. Well, once you have scars, it's very, very difficult to treat. Okay, that's the problem. We want to prevent scars. Okay, but if you already have scars, really nothing at home is going to help remove the scarring. Okay, that's another problem. It would be nice if we had something more effective, but we don't. In the office, we do you can do things like microdermabrasions. You can do actually dermabrasions. What are they? Well, we're sanding down, okay, the skin to help get rid of these scars. It's not an ideal procedure. Sometimes we can inject fillers underneath the scars to lift them up. Of course, it's not permanent.
Right.
Okay, so one of the things we're doing with this study is that we're testing basically a topical preparation put on the skin to see if that actually will help minimize scars.
These clinical studies are amazing. I know that we've talked about them in the past, and they've actually helped with different skin conditions that we talked about. What are some things that I guess the clinical study proves or shows, or what do they look at, like different ages, different nationalities? Like, who are you looking for?
That's a great question
ages?
Too. And you know, one of the problems with clinical studies is we don't have enough ethnicity in the clinical studies.
Yeah.
We need more black patients. We need more Hispanic patients, which is a good thing with our office here because we have a very large Hispanic population, whereas in other regions they don't.
Right.
So, but this study is open to any ethnicity. Okay, black, Hispanic, Caucasian. Okay, you need to have scars on both sides of your face.
Male, female.
Male, female, doesn't
Ages.
matter. Okay, ages I believe are 18 or above. I'm going to check.
Okay.
But yeah.
When you call, Dana's in charge of the clinical study.
Right, Dana's in charge of the clinical study. I have the qualifications right here.
Okay.
It's actually a 7-month study. Okay, and I believe, usually you have to be like a teenager.
18 and older, maybe?
Yeah, younger. You can usually be younger. In this study, it's a 7-month study. So you're basically seeing, you have photographs taken. Okay, so we can judge how well you're doing with this special medication. And patients are paid. Okay, you're not only given the cream to use, but you are paid $100 every time you come in to get your picture taken.
And I guess it's the honor system because the study is only as good as the patient is going to listen to using the cream, using it as they're supposed to use it, I would assume.
And like so many studies, what individuals do is you can use the cream, you basically use it on one side of the face. Okay, so we'll be able to judge how well it's doing compared with, say, the other side.
Okay, so do we talk about any side effects, or what kind of side effects can you get from certain medications?
That's a great question. Well, this particular drug is actually approved. Okay, it's being used and prescribed now. It's just that this company wants to see how well it works for. We already know it works for acne.
Yeah.
Okay, but we want to see how well it works for scars.
Okay.
Okay, because again, once you get scars are they're really permanent. Okay, so if we can use anything that will help minimize scarring, so much the better.
All right, again, clinical study for acne scarring, men, women, any nationality. You can call the number, speak with Dana to get the information. You're paid to do this. It is something that will be going on for a
For a while.
number of months.
Yeah.
But you can take part in the study, and that's kind of cool to be a part of something that's going to make a difference with others who might have acne and suffer with a skin condition that maybe you have.
Absolutely. And acne is very common. So there's lots of people out there with minimal acne, but there's a lot of people out there with scars. And if we can help them, so much the better.
All right, let's talk about eczema when we come back. If you suffer from eczema, you too can be part of a clinical study. Stay right here. You're watching Skin Sense on SSP TV. Welcome back, everyone. Skin Sense here on SSP TV, and we are talking about clinical studies. We've been very serious this show, though. I'm going to have to crack some jokes sooner or later on Doc. What kind of clinical study are we going to do on you?
Well,
figure out what's wrong with you.
Well, my IQ would be a good one. We could see if it exists. So, yeah, I don't know if I'll volunteer myself, though.
There you go. That would be a long clinical study, but we are talking about
might be a very short one, actually. Depends what we find.
We're doing clinical studies on 3 skin conditions: acne, eczema, and
neurofibromatosis.
And if you suffer from any of those 3 conditions, you can call the number on the screen. Dana is the woman in charge of these clinical studies, and she can give you all the specific details. If you're interested in the study, you can give us a call. Eczema is another skin condition I think is very common.
Extremely common. We also call it atopic dermatitis. That's more the medical name, but everybody refers to it as eczema in the public. And it's so common, it affects probably about 10-15% of kids, okay? And perhaps as many as 10% of adults still have eczema.
How do you know the difference between dry skin and eczema? I know from experience when my son was young, real young, I thought he had just dry skin behind the knees and in between his arms.
Right.
And then you're like, nope, that's eczema.
Yeah, well, you raise an excellent point, okay, because those 2 areas are classic for where eczema happens.
There we go.
All right, so people get them behind the elbows, with not the elbows, but behind it, and behind the knees, not the knees, but behind it. And that's classic for eczema. And, what is eczema?
Right.
Okay, it's basically, we call it the itch that rashes.
Okay.
All right, so it's a very, very itchy condition. Many times it starts right, within the first year of life, within the second year of life. Sometimes it can start in adults, though, unusually, but it can. And people are plagued by these itchy patches, just like your kids.
Yeah. Now, is it environmental? Could that play a role in getting the eczema? Because you said you can develop it as an adult.
So what causes eczema? And that's I was going to say $1 million question, the $1 billion question, because so many people have it. And you mentioned environment. Well, people with eczema have certain, so at least some of the people have certain deficiencies of certain proteins that help moisturize the skin. And when these start to be lacking, then your skin dries out. And eczema is, it's characterized by dryness, okay? So you mentioned that before. And that's one of the hallmarks of eczema. Your skin is very, very dry. But believe it or not, eczema also has to do with the immune system, okay? And basically, the more you scratch, you're basically tearing up your skin, and your body is reacting to you scratching. And it reacts, believe it or not, in an immunologic way. So it sends these immune cells into that area, and those cells actually help promote more itching.
I know the top of the foot too, especially, I saw that in my son, the top of the foot, he used to get it near his ankle, and thinking, what the heck is that? It's not dry skin, it's not a bug bite, it looked like some kind of rash. The second you put that topical on, though,
that's a good question too, because if you have mild eczema, topical, if you have very, very mild eczema, sometimes just over-the-counter moisturizers work, okay? If they don't work, then you can go to something called hydrocortisone, which you can buy over the counter, okay? And if something like hydrocortisone doesn't work, then you really have to see your dermatologist or doctor for a prescription.
Now, to be a part of the study, let's read some of those qualifications, because you have to have at least 8% of your body covered in eczema.
Right.
With eczema.
Right.
Okay. And you're saying that 20% of kids in the U.S. have it, and a good percentage of adults have it genetically, right?
Well, Yeah, if your parents have eczema, chances are you'll have eczema too. Okay, so there is a very high genetic, component.
Okay, so how is it treated now? We talked about the moisturizers and the topicals, but if that isn't working, so what are some of the specifics to the clinical treatment?
Right, so if that isn't working, then we go to stronger, what's called steroids, corticosteroids, and they're creams, okay? Sometimes we use steroid pills, steroid injections. Sometimes we use something called ultraviolet light, because a lot of people with eczema do much, much better in the summertime. Okay, not all. Some people with eczema do worse in the hot weather, but a lot do better in the sun.
The extreme cold or extreme hot.
Yeah, and we don't recommend sun for too many things. Okay, but for people with eczema that's not being very well controlled, yeah, by all means. Okay.
Could chlorine or like kind of chemicals affect eczema more?
Yeah, if you have
eczema more.
Yeah, if you have sensitive skin, yes. Okay, you're going to be more prone to
fabric softener. Yep.
All those things can make eczema worse and aggravate it. Yeah.
Okay. So what is the clinical study for?
Well, getting back to treatment. Okay, in 2017 we had a revolutionary treatment for eczema. I'm sure everybody's seen the commercials, Dupixent, Dupilumab. Okay, it's revolutionary because we never had anything like that. And it's basically little injections you get every 2 weeks, okay? But it helps so many people with eczema that's why we call it a revolution. But since that drug came out, other companies are basically working on products that are somewhat similar in that they kind of dampen the immune response, okay? And one of the ones that we're studying is a similar, it's called the biologic. Okay, you get an tiny little injection every month. You get the medicine for free, okay, and you get paid for using it. I believe every time you come in each month, you get a check for $100, okay? So, and there's some people who Dupixent hasn't helped, okay? Some people can't afford the medication.
Right.
So for those out there who have moderate to severe eczema, by all means, I would highly recommend, okay, at least contacting our clinical supervisor, Dana, to see if you qualify for this study.
How effective have these clinical studies been for other things that we've
Well, that's how you bring things to market, okay? And we've been part of a number of studies that the drugs are now available, okay, and approved by the FDA. And to get a drug to market, you have to do clinical studies. Then the FDA has to review these clinical studies. And if the data looks good, well, we all know what's going on with COVID and vaccines and clinical studies, okay? Once the FDA has shown that it both works and that it's safe to use, then the FDA will grant approval.
And not to get on a rampage about COVID, but when people are still talking about should they or shouldn't they get the vaccine because they're scared of things they're putting in their body, has the FDA just expedited this process because it's a pandemic?
Well, you know, I heard a very good, it's not my comparison. I think it's a CNN commercial. How many out there have had smallpox? How many out there, meaning the audience, have had polio? Okay, 0. And why is that? Because they're vaccinated. Okay, so vaccines work, and you know, we've already lost, 700,000 people, and we don't want to lose any more.
Right. So back to the clinical studies. We have about 1 minute. The number's on your screen. Talk with Dana if you think you qualify for any of these skin conditions, acne, eczema, and neurofibromatosis.
No, perfect. All right, we'll have to compare IQs.
How about it? Yours might be a little lower than mine. We'll see.
You speak highly of yourself.
There we go. Bump. So that is our show for today. It's always, this one was a very serious show, but these clinical studies are important, so we want you to call, get the information and the specifics. The main point is that you're testing on the correct kind of person for these studies.
And we do, screening just to make sure we do that. And if you're eligible, you'll benefit not only because you'll get the medicine for free, you'll get paid for it, and you'll be helping perhaps bring another medication to market. Yeah,
you'll make a difference.
Yeah.
So give Dana a call, the number on your screen. Doc, thanks for joining us here again on Skin Sense. If you have any other skin concerns, you can call the office here, and you're readily available.
Absolutely.
All right, we'll see you next time on SSP TV.